Alicia Santilli. I'm the Director of CARE, which is the Community Alliance for Research and Engagement. Our mission is to improve health in New Haven. Fairhaven is one of 6 low-income neighborhoods in New Haven. Fairhaven is predominantly a Latino community. If you look at most health conditions, you'll see a much higher rate among communities of color, and so Fairhaven is no different in that regard, and unfortunately has much higher rates of things like diabetes, heart disease, asthma, and a variety of other chronic conditions.
I used to work for CARE. I was one of their research assistants conducting door-to-door health care surveys. We came to realize that we were really unhealthy, and so the trail was a great idea.
Walking is so important in the lives of so many patients that we have here because it's a form of exercise. Things like obesity, heart disease, depression and anxiety, all of those are treated by medicines, but they're also treated by walking.
My name is Melissa. I am a registered nurse here working in the pediatric department. I have a really huge interest in helping people change the way they eat, their lifestyles. I have been going on walks during lunchtime, and I think it really helps to clear my mind. And I said, let me start asking other people, like, do you want to walk? When a lot of people told me, yes, I want to walk, I said, let me create a Facebook group. So this is a chance for people to come together and say, hey, let's go to on a walk during this time, or let's get together on the weekend and go for a walk. So for me, I've lost 30 pounds just simply by walking and changing what I eat. And I haven't been going to the gym and like killing myself in the gym.
Al principio uno lo piensa que es duro, pero tiene que pensar que es por la salud de uno, por el bienestar de uno. Y el cambio fue bastante grande porque antes la salud estaba pésima, mucha asma, mucho sobrepeso, pero gracias a Mari, a Vivian, los consejos de ella, me puse en mi número y está mejorando la cosa. Mi opinión sería que mientras se pueda que lo hagan, porque si a mí me da tantos resultados, a otros les puede ayudar también.
Last year, my heart was in AFib and I felt so weak and I couldn't do anything and I wasn't getting any exercise and depressed and stressed. I couldn't get up out of the house and make myself go walk. And I asked my boyfriend and he agreed, drop me off at the Greenway and I'll walk home. And then last July, I felt so much better. So then I tried getting out here 2-3 days a week, every single day, absolute minimum a mile. And I'm actually starting to jog now. And I'm going to do a 5K run walk this month before the end of the month, and then a 10K, and by the end of summer, a triathlon. So I'm energized about this open space and the trails and the friendliness.
I got into the habit of walking around in the neighborhood, and increasingly I ventured farther and farther from the Merriwade home on foot across an 18th century drawbridge which crosses the river. It gives me a feeling of freedom that I can walk with a cane for miles.
I think one of the nicest things about it is to meet the people that are sitting on their front porches when you go by. And if you've gone twice, they recognize you and give you a big hello. You stop and visit. Those are things you don't get when you're in the car. People would say, oh, you can't go to Fairhaven because it's very dangerous. And that's gone now.
My name is David Weinreb. I'm a bilingual teacher for New Haven Public Schools. And right now I live about 5 blocks away from my school here in Fairhaven. I think it's essential that children have the opportunity to explore their neighborhoods, to know their environment, to get to see the green and not green beauty that surrounds them and that's close to them, and that they realize that they don't have to go far. So today, Pablo and I are going on a run on the trail. I run every day, normally before school at like 6:30.
I like being able to walk and run on the trails, and I feel like they're different from other streets because I find them cleaner.
I think that a lot of our families who have moved here from Latinx places see this place as cold and sometimes doesn't feel super safe, or at least is unknown, and I think we can help families and children feel safer walking and being in their communities, and that's all of our responsibility.
The Fairhaven Family Stroll has been going for 9 years at this point. It takes place here in the Quinnipiac River Park, typically the first weekend in May. The stroll's focus is really on the importance of early childhood education and care, particularly in urban communities like Fairhaven, where there's really a lack of affordable access. So the New Haven Free Public Library comes, the Fairhaven Community Health Center comes, the Peabody Museum comes, and they all come and provide community resource information to families. This section of the trail system, the section at Criscolo Park, and the budding section over at the Mill River is such a great opportunity for inner city families to get out into green space and to walk around and feel safe doing that.
We've been at community building and neighborhood building for literally decades, and the Urban Walking Trail in Fairhaven fits right into that. We've seen dramatic change that benefits the people who live there and benefits everybody who visits there.
It's not just being used by one group of people, it's being used by everybody, and everyone feels safe there. We're not in a silo. We can do this in a community networking way, and so we've proven that yes, it can be done. And so we hope that we can lead by example so that other people can create other trails.